My job's called the Gooch Transitional Nurse Specialist. Gooch stands for Grown Up Congenital Heart. And although it's this transition in my job title, I'm really sort of transfer nurse. I look after 16 to 25-year-olds. I've been funded through the British Heart Foundation for 3 years because they, along with other specialities, realise the importance of having a good transition for young people moving from the children's services into the adult services. So my job really is to come into your last clinics at the Children's Hospital with your cardiologists, usually around about 15, 16 years of age. Get to know you so that you've got a familiar face when you come over to the adult services. To tell you a little bit about the adult services, who's who, how the hospital runs, because going into an adult hospital is very different to being in a children's hospital. I do clinics in the adult sector, so when you go to your first outpatients appointment, I'll be there to sort of meet you so that you've got a familiar face at your first clinic appointment. If you have to be an inpatient, I'm also there to help support you through that as well. I've got a mobile phone so that if you need any help or advice about anything, you can ring, or if you don't want to ring and ask, you can get your mum or your dad to ring, and I can either find out the information for you if I don't know it myself, but certainly try and help you with whatever you need to know. So really transition should start around about the age of 12, but my part of the job is coming in sort of for the transfer part of it and looking after you in the adult services. It's very interesting, very awe-inspiring that people like yourselves just get on with their lives. They try not to let anything get in their way of leading as normal a life as they can. And it is very interesting being at the forefront of new medical and surgical procedures that are coming out, because things are improving all the time. When I first started in ITU 20 years ago, it was a very different story as to life expectancy, and to see that change over 20 years is quite exciting. To get a heart transplant, you obviously need to have a donor, and there aren't a lot of heart donors out there, because if you think about it, somebody does have to die for a heart transplant to take place. And it's been in the press a lot recently as well about the lack of organs for donation. It's not just hearts that are in short supply, it's livers and kidneys. And until you get the message across to the public at wide, so that there are more organs up for donation, then there won't be the numbers around. Also, if you're talking about having heart transplants for complex hearts, a lot of them will probably need to be done in the neonatal period, and again, there aren't an awful lot of neonatal hearts that come up for transplant. So, and to go along the route of other surgical interventions first is probably the best way to go. I can talk from the point of view from being in the adult services, when it'll probably affect sort of when you're in further education really, and universities. And what we do in the adult services is we try and get your outpatients appointments to go into your holiday times so that you're not having to come back during term times. Now that's slightly different in the children's sector, because every patient that's coming in there goes to school, so you can't just do holiday time clinics. So there are going to be times when you will have to miss school, and unfortunately there's not an awful lot that they can do about that. But if you're well and you're only on a yearly appointment system, whether you can try and get those in the holiday, if you can, or towards the beginning or the end of a school day so that you don't miss too much school. I think it's important, especially with complex heart defects, that you are that you keep going for your checkups and follow-ups to the hospital, so they can see if there's any change in your condition, so they can see if medication needs to be changed, whether you need to have cardiac catheters to see what things are like inside your heart. So it's really important that you keep going so that you can be kept as well as you are now.